Hello from Orlando, Florida, guys. So I'm down in Orlando for the month of April for my pediatric emergency medicine month. It's Monday. I got here on Thursday, so I've already had a few shifts. I've been working night shift for the past 3 nights. So I worked last night 11 p.m. to 8 a.m. It's now like I think 3:30, kind of just getting my day started. I'm not a fan of night shift at all. Not because it's hard to stay up at night or anything like that. It's just it throws off your sleep schedule. Like the next day you wake up, I just feel like, I don't know, tired, groggy. It takes a while to get my day started and I kind of feel tired throughout the day. So yeah, it's one thing I don't like about night shift. But yeah, gonna get my day started. Gonna head out, get some lunch, get some groceries and meal prep for the week. Oh my gosh, the heat is insane today. It's like 85 degrees out. I'm gonna have some bolé for lunch. Alright, so I got one of their bowls. The base is these sweet potato noodles and then some potatoes, some Thai shrimp, broccoli, and a bit of cilantro. So yummy. They have one in Gainesville too, and it's kind of become my go-to spot. I am stuffed. Now it is time to do some grocery shopping. Good morning. So I'm getting ready to head into work. This morning I'm actually spending the day in the OR, so I'll be having like an anesthesia day. So spending the morning intubating the pediatric patients. I actually spent a full month in December doing like an anesthesia rotation. That was of course with adults. So by now I've gotten like over 40 intubations for the year, none on kids. So today would be a pretty good day. You know, having the day intubating pediatric patients. The first case is at 7 a.m. Oh, it was a struggle getting up this morning. I went to sleep pretty late last night because my body is still like on night shift schedule. So yeah, hopefully have a few cases, get a few intubations in, then I'm coming straight home to take a nap. Differences between pediatric airway and adult airway is that the airway is just a bit higher up, so you don't have to go as deep with your blade. But first case is done and the second one starts at like 10 o'clock. So I just came down to the cafeteria to get some breakfast. Everyone just seems nicer at the children's hospital. Like everybody's in a good mood, people aren't grumpy, everyone says hello. Yeah, it's definitely different working with kids. Such a small world. Yesterday and this morning I ran into one of the third-year medical students who I worked with back in January during my OB-GYN month. He was up in Gainesville rotating, doing his OB-GYN clerkship. And now he's back down here in Orlando where his school is doing his ENT surgery rotation. So that was cool running into him again. All right, it is lunchtime now. Stanley's on FaceTime. We get like meal cards, so we eat free here at the hospital. It is such a beautiful day out though. I am done, headed home. Such a nice day out. Probably gonna take a nap and then hit at the gym. But repetition. The more you do, just the better that you get at things. In this case, intubations. Yeah, I've done a lot so far during my first year, and I'm just getting more and more comfortable with airways. Hello. So the last time I talked to you guys, it was Monday after my day in the OR. It is now Thursday. So Tuesday I had off. Then I was back on night shift on Wednesday night, so I worked last night. and I'm working again tonight, and this is my last night shift of the month. Man, yesterday I walked into the ER and the waiting room had like at least 16 kids waiting to be seen. It was super busy, and we ended up clearing out the waiting room relatively quickly though. By 2 a.m. 3 a.m. it kind of slowed down, and then it picked back up again around 5 6 a.m. when the shift was ending. But yeah, one more night. I'm so happy to be done with nights after tonight. But yeah, this past week Stanley and I had just been finishing up last minute things for the wedding. We're pretty much set. We're like 2 weeks out. What's remaining is we still have to get the alcohol. We're having an open bar, and our bartender sent us like a full list of drinks to get, and then we're gonna make a custom menu. So we're gonna finish getting that, and then making a timeline for the program events, and then printing out like the place cards to go at each seat. So those are the two final things that we need to do before the wedding day. Somebody in the comment section asked me the other day, like, how feasible is it to plan a wedding during residency? I think it's absolutely doable. People do it all the time. People have weddings all the time during residency. But I didn't plan most of mine during residency though. You know, mine was supposed to be last summer, but of course got postponed due to COVID. So by then pretty much everything, like the major things, were checked off. I had done pretty much everything by then, so really not much planning this past year during residency, but it's definitely doable. Maybe get a wedding planner, I don't know. Stanley and I planned ours on our own, and it was very much doable. I mean, if you're organized, and there's so many resources online as far as wedding planning, but my sister planned her own wedding a few years ago, so I kind of took her list of all the vendors and like compared prices, used some similar ones, got some new ones, so that was pretty helpful starting off with that. And then if you're gonna plan on your own, really delegating and getting help where needed. Like my maid of honor has been helping with a few tasks, so definitely doable to plan your wedding on your own. But if you feel like you're gonna be overwhelmed, and if your budget allows it, then definitely get a wedding planner. Definitely helps to wake up, get outside and walk around after having a night shift, because I just wake up feeling like a zombie after having a string of nights. But just about to grab some lunch. So I'm planning on going back to Gainesville this weekend. Sometimes you just miss the comfort of your own home and your own bed. Plus I want to like fully cook. I don't have like all my seasonings and things here, so it's just a short drive, like an hour and 45 minutes. So I'll go back on Saturday after I get off of work, and then on Sunday so I plan on joining Gainesville Health and Fitness, and I'm really excited about joining this gym. I feel like I haven't fully reached how I want to work out in my apartment gym because it's a bit limited. But Gainesville Health and Fitness, it has like so many classes throughout the week. It's a full gym, and so on Sunday it's like a first workout training session, so I'm going to that. I'm not gonna lie, I don't like that my program has like a away rotation like this where we have to go somewhere else for a full month. I understand the need for it since we don't have a children's hospital, so we come down to Orlando for a month every year and, you know, do our PDM month. We also during first and second year do a full month kind of off-site for our trauma rotation. That's 45 minutes. You can choose to stay there for the full month if you want, or you can commute. But I mean, to be taken out of your home for a full month, maybe you have kids or you have a significant other, I mean, that's just something to consider. I would prefer not to have these away rotations. It is nice to be out in a different city, maybe for like a weekend or a week, but a full month is a bit much. It is so nice out here. Such a beautiful day. I feel like I always say that about the weather over here. When I first got down to Florida last summer, like, what was it, June, July, it was scorching hot. I was like, I don't know how I'm gonna handle this heat, but it got better, and I do appreciate Florida's weather. Like, the winter was amazing. It was about maybe 70s, never really got cold, which is nice, of course. But yeah, I really appreciate Florida's weather. All right, guys, it is about that time, 10:40. Heading into another night shift, which is 11 p.m. to 8 a.m. So I'll see you guys tomorrow. Okay, so I'm back in Gainesville. I drove up here after I had a shift this morning. So I've done 7 shifts, and I have, I think, 9 more total. What's 16 minus 7? whatever that is. That's how many shifts I have remaining for this month. But just a little bit about pediatrics. I don't like pediatrics, which is why I'm not a pediatrician. I'm an emergency medicine doctor, but obviously kids have emergencies too, so you need to be comfortable and know how to manage pediatric patients in the emergency department. So let's see, a lot of what I've been seeing in the peds ED this month is a lot of gastroenteritis. So many kids have just been coming in with vomiting alone or vomiting with diarrhea, a lot of fever, a lot of cough, a lot of croup, a lot of like bone injuries like falls or playing sports, things like that. The biggest difference between treating kids and adults, in my opinion, is just you do way less, like less lab work, less imaging. Like literally any adult that walks into the ED with the camera's about to turn off, but any adult that so my camera did turn off, I ran out of memory. But so any adult that comes into the ED with the chief complaint of abdominal pain, they're likely automatically going to get a CT of the abdomen. That is not the case with pediatrics. Abdominal pain, not everybody gets a CT, of course, not everybody gets a abdominal x-ray. Something that's pretty common is constipation, and in that case maybe we would get an x-ray and we'll see maybe some stool impaction in the rectum, and then we just give them an enema, and they're usually able to have a bowel movement after that and they're discharged home. I see that parents really get freaked out about fevers, so that's a large volume of what I've been seeing this month. Just literally the chief complaint, fever, and that's it. Yeah, I think parents think the worst when they measure their kid's temperature and see that they have a fever. And fever could be a number of things. It could be a viral illness, it could be upper respiratory tract infection, it could be UTI, it could be strep throat, it could be an ear infection. It could be a number of things. I guess maybe when I'm a parent, I'll see how it feels to have a kid with a fever and see if it's necessary to come to the ER. But oftentimes it's things that, you know, can be managed at home or outpatient pediatrician's office. I'm curious to know, like, how often pediatricians get sick from their patients, because I can't imagine treating kids without having a mask on day to day. Now obviously wearing a mask is the new normal, but before this, you know, when you're going by your everyday your normal everyday interaction with your patient, with the kid, you're not going to be having a mask. But just the way that they cough in your face, they sneeze in your face, like, I just imagine pediatricians are so prone to get sick. So I had a patient come in today with fever, headache, and altered mental status. Now when you hear those things, what diagnosis do you think of? Maybe meningitis, maybe encephalitis. I had a consult neurology and they recommended getting a lumbar puncture. This was literally right at shift change, so I did not stay for the procedure. I'm not even sure she ended up getting it because she also had a history of recurrent UTI, so the fever and all that could be attributed to, you know, urinary tract infection. It was very interesting to see how she presented with the altered mental status. I think as an attending, I would want to work in a place that has the adult ED and the pediatric emergency department separated, or either just the peds patient seen strictly by pediatric emergency physicians. You know, I just prefer not to have to treat kids if it was my choice. I'm not saying it's horrible, but I just prefer to treat adults, honestly. I don't know, kids are just like a whole new world. They're different. They're not tiny humans, they're different. So remember that if you are interested in emergency medicine, your time with pediatrics does not end in medical school. You'll still be treating pediatric patients as an ER resident at least. As an attending, of course, you know, you have your choice where you work and what kind of patients you see. All right guys, I'm gonna go ahead and wrap up this vlog. Tomorrow, like I mentioned earlier, I'm gonna go check out Gainesville Health and Fitness and see if I want to join that gym. But from what I'm seeing so far, I think it is a gym that I would like to join. So I'll let you guys know how that goes. If you enjoyed this video, make sure you give it a thumbs up. Make sure to subscribe if you haven't already, and I'll see you guys next week. Bye.